Radiosurgery is an advancing medical field that uses advanced technology to precisely target and treat tumors, especially in the brain. This video will explore various radiosurgery techniques, including IGRT, stereotactic radiosurgery, and robotic systems, providing a comprehensive understanding of the field's principles and applications. Radiosurgery is based on the fundamental principle of delivering a high dose of radiation to a specific target while minimizing the radiation exposure to surrounding healthy tissues. This is achieved by utilizing precise targeting techniques and advanced imaging modalities to accurately determine the size, shape, and location of the target. Through meticulous treatment planning and effective delivery systems, radiosurgery aims to maximize the therapeutic effect while minimizing the potential side effects. Image-guided radiation therapy is an essential component of radiosurgery, as it enables real-time visualization of the target and surrounding structures during treatment. By integrating imaging technologies such as CT, MRI, and PET scans with the treatment delivery system, IGRT provides accurate and precise targeting, ensuring that the radiation is delivered to the intended area with high precision. This allows for optimal tumor control and preservation of healthy tissue. Intracranial stereotactic radiosurgery involves the treatment of tumors, arteriovenous malformations, AVMs, and other intracranial conditions using a highly focused radiation beam. This technique utilizes a specialized coordinate system, known as a stereotactic frame, to precisely localize the target area in the brain. With the aid of advanced imaging techniques, three-dimensional treatment planning, and highly conformal radiation delivery, intracranial radiosurgery offers excellent outcomes with minimal invasiveness. Extracranial stereotactic radiotherapy extends the application of radiosurgery beyond the brain to treat tumors in various other parts of the body, including the lung, liver, spine, and prostate. This technique uses sophisticated image guidance and immobilization devices to ensure accurate patient positioning and precise delivery of radiation. By precisely targeting the tumor while sparing healthy surrounding tissues, extracranial stereotactic radiotherapy provides an effective treatment option for patients with localized tumors, offering improved outcomes and minimal side effects. Frameless stereotactic radiotherapy eliminates the need for invasive head frames and utilizes non-invasive immobilization techniques to ensure precise positioning of the patient during treatment. This approach offers greater patient comfort and convenience while maintaining the accuracy and precision of treatment delivery. By using advanced imaging, respiratory motion management, and real-time tracking systems, frameless stereotactic radiotherapy enables treatment in areas of the body prone to movement, such as the lung and abdomen. Fractionated stereotactic radiotherapy involves delivering the radiation dose in smaller fractions over multiple treatment sessions. This approach allows for increased dose conformity and a lower risk of complications compared to single-session radiosurgery. By fractionating the treatment, fractionated stereotactic radiotherapy achieves improved tumor control while minimizing the impact on surrounding healthy tissues. This technique is particularly beneficial for larger tumors or those located in critical anatomical structures. Robotic radiosurgery systems utilize robotic arms and advanced computer algorithms to precisely deliver radiation to the target area. These systems offer unparalleled flexibility and accuracy in treatment delivery, as the robotic arm allows for precise beam positioning and adaptation throughout the treatment process. By integrating multidimensional imaging, real-time motion tracking, and adaptive treatment planning, robotic radiosurgery systems provide highly tailored treatment options for a wide range of patients and conditions. Understanding the radiobiology of stereotactic radiosurgery is crucial for optimizing treatment outcomes. Stereotactic radiosurgery harnesses the principles of high-dose radiation therapy to induce DNA damage in tumor cells, leading to their destruction. By exploiting the differences in DNA repair mechanisms between tumor and normal cells, radiosurgery achieves tumor control while minimizing damage to healthy tissues. In addition, the radiobiology of radiosurgery is influenced by factors such as fractionation, cell cycle, and tumor microenvironment, further shaping treatment strategies. Accurate dosimetry and treatment planning play a pivotal role in radiosurgery. Dosimetry involves determining the radiation dose required to achieve the desired treatment outcome and ensuring its precise delivery. Treatment planning takes into account factors such as tumor characteristics, critical organ constraints, and dose distribution optimization to devise an optimal treatment plan. Through the use of advanced computer algorithms and imaging techniques, radiosurgery treatment planning enables personalized treatment strategies that maximize tumor control while minimizing side effects. Linear accelerators, LINACs, are commonly used in the delivery of stereotactic radiosurgery. LINAC-based systems offer the advantage of versatility and accessibility, as they can be integrated into existing radiation oncology departments. These systems utilize sophisticated beam shaping technologies, such as multi-leaf collimators and rotational gantries, to precisely deliver high-energy radiation to the target area. LINAC-based stereotactic radiosurgery provides a safe and effective treatment option for various tumors and lesions, offering excellent outcomes with minimal invasiveness. The CyberKnife system is a state-of-the-art robotic radiosurgery system that combines advanced imaging, real-time motion tracking, and sub-millimeter accuracy in treatment delivery. This system utilizes a compact linear accelerator mounted on a robotic arm, allowing for precise targeting of tumors in various anatomical locations. The CyberKnife system offers unprecedented flexibility in treatment planning and execution, ensuring highly conformal radiation delivery while adapting to patient motion during treatment. With its unique capabilities, the CyberKnife system has revolutionized the field of stereotactic radiosurgery. Clinical indications and evidence-based practice play a crucial role in guiding the use of SRS/SRT. By analyzing a wide range of clinical studies, treatment guidelines, and expert consensus, clinical indications for SRS/SRT have been established for various tumor types and locations. Evidence-based practice ensures that treatment decisions are made based on the best available scientific evidence, taking into account factors such as efficacy, safety, and patient-specific characteristics. By adhering to evidence-based practice guidelines, clinicians can optimize treatment outcomes and improve patient care. In conclusion, recent advancements in radiosurgery have transformed tumor and lesion treatment. Understanding principles, advancements like IGRT and CyberKnife, and evidence-based practices are crucial for optimal patient care. Medical students must stay up to date to shape the future of radiosurgery and enhance patient outcomes.